whichever it is. So we'll go with the first talk, that is the SICS basics, the must-read books. The topic will be dealt by Dr. VAISAKHI Prasannan. She is the pediatric surgeon at Pallarivattam Chaitanya Eye Hospital.
Very good morning to all, very good afternoon to all, and welcome to the first session of today's IC. Starting with, you should always know what you do. We know that the eye sees what your mind knows, and hence this is the basic dictum before starting any surgical training. You should be well thorough about the surgical anatomy, the steps of the surgery, instruments to be used in the surgery, when to modify each step, complications to be anticipated in each step, how to identify complication and manage them. And how to learn this? We have textbooks and literature, classes, observing our seniors, colleagues and even juniors, a thorough wet lab practice to improve our surgical hands, videos and discussions. Though videos and discussions are the fastest and more reassuring part of learning these things, you should be thorough with the basic principles of each techniques to be used, and for that textbooks and literature play an important role. In this session, I'll be briefly discussing about each textbooks which you can refer to for learning basic principles of cataract surgery. First one is Henderson's manual small incision cataract surgery book, which gives a brief detailed description about the instruments, the surgical anesthesia, steps of surgery with diagrams, complications, their identification and management. This SICS book by Ashok Garg et al. Is an elaborate book which starts with anatomy of crystalline lens, etiology and classification of cataract, followed by principles of sterilization, anesthesia, steps of surgery. It also explains the dynamics of each step, and it finally mentions about the recent advances and special techniques. This CME series by for manual small incision cataract surgery is a brief textbook which is very concise, and this will help you to brush up each steps of cataract surgery and about the management of complications. Manual small incision cataract surgery by Aravind. This is a brief book which explains in details about the instruments, surgical steps and complication identification and management, and this explains each step using diagrams, which will be very easy to use and understand for the PG students. And coming to this elaborate textbook on cataract surgery by Sternert, and this starts with the pathology and classification of cataract, is explained about different methods of classifying cataract, followed by anesthesia for cataract surgery, IOL power calculation, different IOLs, and it also explains using diagram steps of cataract surgery and how to manage each special case, including intumescent cataract, use of toric lenses and small pupil. For phacoemulsification surgery, this should be your Bible, the book by Siebel. This explains in detail the phaco-dynamics as well as each step of phacoemulsification surgery, and book by Hirschman et al. Apart from that, there are a lot of online sources for learning. The OroTube channel by Aravind Eye Hospital, Pondicherry, it explains in detail surgical techniques as well as management of special cases and complication management in case of cataract surgery. Understanding the mechanism of each step in learning helps in learning as well as practicing them in a better way. It will boost your confidence, and knowing the dynamics of cataract surgery will help you to do cataract surgery better, as well as it will help to get a good outcome for the patient as well. Thank you.